It's wonderful.
Thank you. On my last two episodes, I cover Medicare. Today, let's discuss some key takeaways that will guide you on your journey to Medicare. And this is very important. This is a refresher for you. So, for example, actually, not example, it's my first slide. So, it's all about income. Take note, income does not affect your eligibility, but it does affect how much you will pay for premium. So that the reason why you already satisfy your 10 years contribution to Medicare taxes, and that's why you don't have to pay. And for Part B, as a legal resident for 5 years, then you are eligible to get Part A and Part B, wherein Part A is about income, it's about work history for 10 years, and then Part B is about residency. So, however, you will pay a higher premium based on your income bracket. For example, to determine your 2023 income-related monthly adjusted amount, it will be based on the 2021 and 22 taxes. They work 2 years back. So, for example, you sold the house, and then that's a year prior. Then you will notice that your Medicare premium went up. Why? Because it's income-based. So that's a huge markup to your income. So just like I said, for example, your monthly premium for Part B is $164.90, but it can go up to $395, and for Part D premium, as much as $76.40. So you won't pay extra for Part B or Part D if you earned a maximum of $97,000 or less as an individual, or $194,000 or less if you are joint filer. But of course, if you sold the house and you profit, of course, that it's considered a profit, especially when you have equity in the house. So for example, individuals who made $100,000 in 2021, you will pay $230 per month for Medicare Part B in 2023. The added charge is known as Income-Related Monthly Adjustment Amount, or IRMA. Okay? That means if you say, oh, that's IRMA, that's the meaning. The Social Security Administration determines your IRMA based on the modified adjustment gross income on your tax return. If the Social Security Administration finds that you owe a higher premium, the agency will mail you an IRMA letter to let you know that your new payment amount for those for that year. Because of course, just like I said, the previous 2 years will affect your Medicare premium. So now let's go to slide B. So slide B is, if you are not receiving Social Security benefits, you must enroll manually. People who retired early are automatically enrolled with Medicare, and they will get their Medicare card months before they turn 65. However, if you are not retired, then you can sign up for Part A when you first became eligible for Medicare, beginning with the initial enrollment period, which we call IEP for short. They only want to get their Part A you only want to get the Part A if they have employer coverage and they can enroll with Part A. At a later date, depending on their circumstances, of course. So you can enroll in Part B depending on your circumstances. But if you are employed, I would suggest you get your Part A. It's premium free, and you already have your Medicare at hand. And you can already apply for Part B anytime if you lost your employer coverage for some reasons. So now let's turn to slide 3. Medicare is automatic only if you are receiving Social Security benefits. Again, people who retired earlier than 65 is automatically enrolled with Medicare when they turn 65. When you are already receiving Social Security benefits, you will get your Medicare card in the mail months before you turn 65. So I have this client wherein at least since he was enrolled in Medicare, in 4 months, the Social Security already sent, Medicaid. He was on a low income until age 64. And then 4 months prior to turning 65, Medicare already sent him his Medicare card. So watch out if the system automatically generates your Medicare card once you are already receiving benefits. Okay, let's go to slide 4. This is about premium. Medicare Part A is premium free to those who qualify. Medicare Part B has a monthly premium. So Part A is hospital insurance, and it is zero premium for most people because they or their spouse paid Medicare taxes long enough while working. Generally, at least 10 years. Medicare Part B is the medical insurance side, and it helps cover for services from doctors and health providers like outpatient care, home health care. Please take note, not long-term care, home health, wherein a nurse comes to your house, check your vitals, your BP, and everything. So durable medical equipment, wherein you have this 20% copay with wheelchairs, walkers, hospital beds, and other equipments. If you are a legal resident for 5 years, you are entitled to Part B, and it has a monthly premium of $164.90 for 2023, and this is for most Medicare beneficiaries. We go to slide 5. This is about enrollment. I tried to just piece them together just to make sure that you have a focus on enrollment. There are different types of enrollment happening in a Medicare 1 year, in a year rather. So a lot of people are not aware that there are different types of Medicare enrollment happening in a year. I myself, I'm not aware that when I started to become Medicare sales agent, well, I didn't know that there are actually 6 Medicare enrollments. So there's IEP enrollment period when you're turning 65. There's the GEP when you miss to enroll when you turn 65, and it happens every January 1st to March 31st. So if you miss to enroll when you turn 65, you have to wait for the GEP, which is a general election period. Otherwise, if you send a letter since you wanted to apply for a Medicare, no, they will not entertain you because they will say you have to go back January 1st to March 31st. And then we have SEP, which means Special Enrollment Period. It's another enrollment, and you can use this type of enrollment if you lost your employer coverage, change of status from single to married, and you lived abroad and you were going to live permanently in the United States as a retired individual. So now let's go to the next slide. So you can still get Medicare even if you never work. It will likely be more expensive and depends on your spouse's work history. So the non-working spouse is entitled to Medicare health coverage since the contribution of the spouse made is extended to your spouse. However, if the required contribution for Medicare Part A is not enough, then you must pay for Medicare Part A plus Part B premium. So for example, to qualify, you have to contribute 10 years or 40 quarters. If you only contributed 7 years, then you have to pass pay, meaning you have to pay for those years until you could either fast pay that for 1 year, those 3 remaining years, or you continue contributing until you get your Part A. So those are just your options, but that's what it is when you say when you say you will get Medicare even if you don't work, but you will likely pay more expensive, depends on your work history or your husband's or spouse's work history. So we go to the next slide. This is about effective date. Your Medicare effective date is on the first of your birth month. But if your birthday is on the first of the month prior, your effective date will be the first of the month before your date of birth. So generally, the effective date of health insurance is on the first of each month. However, with Medicare, if your birthday falls on the first of the month, the effective date of your Medicare card will be the first of the month prior to your birth month. Let's go to the next slide. So, when you enroll during the GEP, which is the General Enrollment Period, your effective date will be the first of the month. So, GEP is for people who were not able to enroll when they turned 65. GEP happens every first quarter of the year, and it is from January 1st to March 31st. In the past, when you apply during GEP, the effective date will be in July. This 2023, CMS changed the rules of having the effective date to be the following month after you applied for Medicare. So they made it easier and simpler for you to get coverage. Then we go to the next slide. You can get Medicare Part A or Part B depending on what you qualify for. Well, people are not aware that they can avail of their Medicare Part A or Part B. Medicare Part A is about your contribution, and once you satisfy the 10 years Medicare contribution, you will get Medicare Part A. Medicare Part B is about your residency. Take note. So, actually, they can be standalone, one or the other. So, if you have a legal resident in the United States for at least 5 years, you will qualify to get Part B. If you have the 10-year Medicare tax contribution plus you are a resident of the United States for at least 5 years, then you will get Medicare Part A and Part B. Okay? Now let's go to the next slide. A disability lasting for more than 24 months is considered permanent disability and will be entitled to Medicare. So you will automatically be enrolled in Medicare once you receive Social Security disability benefit for 24 months. And lastly, you can enroll 3 months before your birthday, on the month of your birthday, and 3 months after your birthday. This is a total of 7 months for you to enroll in Medicare. If you would like to get your Medicare coverage on time, you can enroll earlier, and that will be 3 months before your month of birth, unless your day of birth falls on the first day of the month, then you must apply another month in advance. Folks, well, if you miss any information, you could visit Maria Care's Senior Info Guide on YouTube, Vimeo, Facebook, and Roku. Another hour had passed. I would like to thank you for spending your precious time with me. Until next week, I'll see you for another episode of Maria Care's Senior Info Guide. Take care of your health. That's the only one you got. Thank you. I look forward to be a part of your Medicare journey. Bye-bye.